Hello friends, welcome to OET Easy Tips. So in this channel, I'll be focusing more on writing correction and case note explanations, and which will be only in English. Many of you were asking me to do videos in English in my another YouTube channel, that is OET Easy Tips, but that channel is mainly I focus mainly on the people or the students who are in Kerala. So here I'll be doing videos only in English. Okay, so I decided to do letter corrections, case note explanations, and all the writing videos in this channel. So if you would like to continuously get new videos which is related to writing and case note explanation, please subscribe to this channel. So let's get started. I have taken a case note here. The patient name is Jeremy Taylor. Today I'm going to discuss how to write a letter based on this case note. Okay, so mainly when you get a case note, you need to analyze the case note, you need to plan your letter and write it. Okay, so there are mainly three steps. Okay, when you get the case note, you need to read, analyze, you need to plan how to write the letter, and you need to implement it, you need to write it down. Okay, so I will be analyzing this letter, and let's discuss together how to write this letter. You can comment your views, your doubts and all in the comment section, and I will try to reply to that. Okay, so let's start the video. So when we take a case note, or when we write a letter, before reading the case note or before reading the patient information, you need to write, or you need to read writing task. Okay, so first thing which you need to read is writing task. Let's read the writing task here. Yeah, so Mr. Jeremy Taylor is a 54-year-old patient in the oncology ward of a hospital in which you are charge nurse. He is transferring from Brooks Bank back to New Abbey using the information in the case notes to provide a treatment summary and follow-up care plan. Address your letter to oncologist Dr. Gerald Johns, 24 Sophia Avenue, New Abbey. When you read writing task, mainly you need to focus on three things. Okay, what's the reader's name, or what is the reader's job title? Okay, the second thing is whether it is a known case or unknown case. Sometimes it will be given in the writing task directly, so you need to see to that. Then you need to concentrate on the purpose of the letter. Okay, so there are mainly three things which you need to focus on the writing task, that is reader's detail, the purpose of the letter, and whether it is a known case or an unknown case. In this writing task, the reader's information is given, right? Address your letter to oncologist. Okay, so we are writing this letter to oncologist. Okay, so the reader's name is clear. Now it's written like Mr. Jeremy Taylor is a 54-year-old patient in the oncology ward of a hospital in which you are charge nurse. Okay, so where we are working, there this patient was admitted, right? Oncology ward. Now this patient is transferring from your hospital to his place. Okay, so his place, he's going back to his place, and we are writing the letter to oncologist who is there in his place, that is New Abbey. Okay, did you understand? So this is how you need to analyze a writing task. Okay, you need to understand and analyze it. Okay, now we will go back to the case note. Okay, so let's see what it is given in the case note. Okay, so here in the case note, first of all, patient's details are given. Name Jeremy Taylor, date of birth is given, and the hospital which he is admitted. Okay, that is Clare Medical College Hospital, where we are working as a nurse, and this patient is staying at the moment. Okay, now let's see the presenting complaints. Okay, on 5th 3rd 2018, this patient presented with respiratory infection and rust colored sputum, right? So patient was visiting because his daughter is in Brooksbank. Okay, patient was just visiting the hospital because his daughter is in Brooksbank, and patient presented with respiratory infection and rust colored sputum. On assessment, the vital signs are given. Patient was prescribed on amoxicillin for 5 days. Okay, that was a management which was done on 5th. On 10th, this patient's details are given, like patient's assessment details are given. Patient had cough, temperature 37 degrees Celsius. Then his investigation revealed stage 2A non-small cell lung cancer, and CT scan revealed category TIC in the left lung. Okay, tumor. Okay, his investigations revealed tumor in his left lung. Okay, now on 15th he underwent VATS procedure which was successful. Okay, and after that he was managed for his pain. His vital signs are given. On 17th this patient got discharged under daughter's care. Okay, so this patient got discharged from the hospital and went back to his daughter's place. Now after that, from 23rd 2018 to 25 2018, this patient had 4 cycles of adjuvant chemotherapy. Okay, and the medication details are given. Okay, so now after this adjuvant chemotherapy, this patient is going back to New Abbey. Okay, so you can write the date as 25 2018 here, because that was the last visit or the last treatment which he got from our care. Okay, so let's see now the past medical and social history. This patient works as a banker. He is a widower, and he has a daughter. Then he leads stressful life. He works 13 to 15 hours per day, lives alone. He drinks socially. He smokes 10 cigarettes per day, and he tried nicotine patches plus electronic cigarettes unsuccessfully. Okay, his medical history shows that he has hypertension and is not compliant with his medication. Okay, so these are the patient's details which are given in the case note, and the last discharge plan is given, like when you write this letter or when the reader get this letter, what are the things they are supposed to do for this patient. So here in this letter, this patient requires referral to a dietitian because 5 kg of body weight loss was there because of chemotherapy. Physiotherapist to help quit smoking, psychotherapist to help quit smoking. Mild exercises need to begin in 2 weeks. Next CT scan is after 3 months. Continue Ramipril and monitor complete blood count, assessment and all is given. Okay, so these are the things where reader is supposed to do, that is given in the discharge plan. Now let's see how to write this letter. Okay, so first, introduction should be very clear. We need to write 3 things in the introduction: patient full name, purpose of the letter, and the main diagnosis. Okay, now here this patient's diagnosis is cancer, right? Stage 2A cancer, small cell lung cancer. So here we can write, like I'm writing to transfer Mr. Jeremy Taylor, who requires oncologist. It is an oncologist, so you cannot write care and all that. It's given there, like write a letter to oncologist and provide a treatment summary and follow-up care plan. So it's just like we are writing this patient's details to another oncologist. So this oncologist should manage his conditions once he get this patient. So we can just write he requires management, further management. Okay, I'm writing to refer, or I'm writing to transfer Mr. Jeremy Taylor, who requires further management. He has stage 2A non-small cell lung cancer. Okay, that's how you need to write the introduction. And in the presenting complaints, you can just write Mr. Taylor was admitted to hospital, or you can just write Mr. Taylor presented to hospital with respiratory infection and rust colored sputum. He was managed with amoxicillin 500 mg twice daily for 5 days. On subsequent days, his investigations revealed category TIC and those things you can just write. After that, you can write he underwent VATS procedure. He was managed with Percocet for pain. After his discharge, he underwent 4 cycles of adjuvant chemotherapy with, you can just write with and write all the medications details because it is an oncologist. Then later on, regarding the past medical and social history, you can just write Mr. Taylor works as a banker and a widower. He leads a stressful lifestyle. He works 13 to 15 hours per day. He smokes 10 cigarettes per day since age 16. He drinks socially, you can write. He has had hypertension since 2010 and is not compliant with his medication. All those things will come in the past medical and social history. And in the last paragraph, you can just write your willingness to provide further treatment for Mr. Taylor would be greatly appreciated, full stop. He needs referral to a dietitian to gain 5 kg of his body weight, which he lost during his chemotherapy. Kindly note he requires psychotherapist referral to help him in quit smoking. Then please note he requires mild exercises which needs to be started in 2 weeks, that you can write. Then off note, his next CT scan is after 3 months, thereafter annually, and chest x-rays 3 times per year. Kindly continue his Ramipril 5 mg for hypertension. Monitor his complete blood count. So all these things you can write because we are writing to an oncologist. He is a medical professional. Whatever is given in the discharge plan, it is very important. Okay, so this is how you need to write the letter based on this case note. Okay, so what I did is I have taken the case note, I read writing task, then I have gone through the case note, I have analyzed it, I read all the presenting complaints first, then I have gone to the past medical and social history, then to the discharge plan, then I will write it in a paragraph wise, like in introduction I will plan what to write, then the first paragraph presenting complaints, then to the second paragraph past medical and social history, and the last paragraph what the reader is supposed to do, or the recommendation paragraph. So this is how you need to analyze the case note and plan how you are going to write a letter. So I hope this video was useful for everyone who is preparing for OET. And if you have any doubts related to this letter, please comment below. I'll try to answer all your doubts. And if you would like to have more videos regarding case note explanation and OET writing, that also you can comment below. I'll be doing more videos based on the response. So thank you all. Keep supporting. I'll come back with the next video. Bye bye.